Welcome to an HMC HealthWorks podcast focused on heart health. I am Megan Stikowski, Director of Client Services and Health Promotion, and with me today is registered nurse and nurse care manager with HMC HealthWorks, Maribel Vargas. She's been with HMC for 7 years and specializes in assisting participants with managing their chronic conditions. Thanks for joining us today, Maribel.
Thanks for having me, Megan.
Well, with Valentine's Day and American Heart Month being in February, there's really no better time to focus on our hearts. Let's start with the top 3 tips that you give to participants who have heart conditions.
Well, Megan, my first tip to the participants would be to always take medications as ordered and follow up with their primary care provider on a regular basis. This includes getting preventative screenings at indicated timeframes. As we know, heart disease is the #1 killer of women, so routine physicals and screenings for everyone are one way to help know your risk of heart disease. Quick tip number 2, if you're a smoker, quit. People who smoke have a significantly higher risk of developing heart disease. A person who smokes 20 or more cigarettes a day is 6 times more likely to have a stroke compared to a non-smoker. And my quick tip number 3 is to implement healthy lifestyles. Lose weight, exercise, and eat right. While this is easier said than done, small steps can make a big difference, and it's never too late to make that first small step.
And speaking of steps, how important is it to stay active for heart health?
Wow, exercise and activity is a very important part of maintaining one's heart health. It helps to strengthen the heart and reduce risk factors. The great thing about exercising is that contrary to what people think, exercise does not necessarily need to consist of hours at a gym. I personally think you should keep it fun. There are many, many things that you can do to get the full benefits of regular exercise, like take a walk with the family, ride a bike, go for a swim, go hiking, go dancing. These are all great ways to get in a good cardio workout that won't cost a thing, and by doing these things on a regular basis, a person can significantly reduce the risk of developing heart disease.
Okay, so exercise is something that I can do. What about the risk I can't change? Like if someone in my family has heart disease, does that mean I will have it too?
Well, Megan, not necessarily. True, although genetics can put a person at greater risk for developing certain conditions, a person's lifestyle can significantly reduce their risk and chances of developing these conditions. Going for routine physicals and maintaining preventative care up to date are of the utmost importance when managing your heart health. It is important to speak with your primary care physician regarding age-appropriate testing, your risks, and family history.
So it sounds like being in the know is really what's best when it comes to our heart health. What else do we need to be aware of for our heart health?
Well, I think being aware of the role of stress related to heart health is important. Megan, according to Johns Hopkins Medicine, stress can literally be deadly. Stress, anger, and anxiety boost blood pressure and stress hormones, which in turn can restrict the flow of blood to the heart, increasing the risk for heart attack and strokes. It is important to manage stress as you would any other condition, which means seeking support from a professional when necessary. I encourage all of our listeners to use American Heart Month as a reminder each year to take care of your heart health.
That is a great idea. Thanks so much for your time today, Maribel. We appreciate your expertise and all the helpful tips you shared with us. And as you know, one way the American Heart Association promotes heart health in February is their Wear Red campaign. Do you plan on joining the Red Wave this month?
Yes, Megan, I do. I do wear red during the month of February, as it is a great way to bring awareness and attention to heart disease. The hope is that the more educated and knowledgeable a person is about their conditions and risk factors, the more empowered they will be in managing their conditions and implementing changes to reduce their risk factors.
I could not agree more. Thanks again, Maribel, for joining us. And thanks to our listeners. Please stay tuned for more HMC HealthWorks podcasts. Stay well.